Hi, Andrea Morsek-Grazzini with WetheP. I'm here today with Dr. Teddie Potter. She's a professor at the University of Minnesota. It's just one of many roles that she plays in her extensive work as a teacher and practitioner of civic engagement, and specifically around cross-sector and inter-relational work in all kinds of realms. So welcome to you, and thank you so much, Dr. Potter.
Thank you. It's wonderful to be here, and feel free to call me Teddie.
Thank you. So we always like to start here. It's hard to start here because I know so many things I want to talk to you about because you're doing amazing work in so many different areas. But we do like to understand you as a real person, certainly Dr. Potter, and yet we also know that there's something very substantive that probably brought you to the place that you're at today. Your ideals, your values, those epiphany moments. So can you bring us back a little bit to, and specifically focusing on where in your background you sort of understood yourself as not only concerned about people and health, because I know that you're a nurse as well, but also how that relates to the world and you in particular.
Sure. I have always seen things connected. Ever since I was a little child, I couldn't separate out being interested in just one thing. Everything was all connected, all part of one other pieces. So it was hard for me to think about what type of career would I aim for. I went to a small college here in Minnesota and was headed down the medical path, and when I applied, he said, you've got top scores, you can easily be in med school, but have you thought of nursing? I didn't know a nurse, I didn't know what nurses did, I had no clue. And I thought, but I'm very pragmatic, I'd keep my doors open, because it was very difficult to get into nursing later. You needed to apply and be accepted into the school. So I applied, kept my options open, got accepted into the nursing program, sat in my first class kind of like, oh yeah, what's this about? And I was mesmerized. Nursing explained everything I felt about how people heal, that it's not just about what we say bugs and drugs. It's about people healing on many, many levels, many, many factors. You need to be looking at them holistically. What's their family situation, their social context, their historical past. And it all resonated. And so I never looked back. I never looked back. And I still, people will say, oh, would you have chosen another career, or would you recommend people choose another career? And I say, nursing has been the greatest career I could ever imagine.
So the sky was the limit for you, and you knew this, and that can be really overwhelming for a college student or even a high school student going, I know I'm bright, and I have all these interests, and I see how things connect. Nursing, it sort of connected it all in one career in a sense, and my sister's also a nurse practitioner. So I've often said, you know, why don't you be a doctor? And there's a part of her that wanted to be, but when she speaks with passion about nursing, she's speaking to, I think, what you're talking about. What is it about nursing that makes it different from being a different medical professional like a doctor or, you know?
That's a great question, and that's actually, I addressed that in the book that I just wrote because I wanted to look at medicine, the word medicine. As long as one profession owns the word medicine, it's always going to be higher on higher on the pecking order or higher on the order. And my work has been around leveling sort of the order and bringing us in as full partners. So I wanted to look at the word medicine. I went back and looked at the Latin. It means the art of healing. And then I looked at the Latin word for healing, and it means to make whole. So I asked, how do we make people whole? Do nurses make people whole? Do we have medicine? Absolutely. Pharmacists have medicine. Social workers have medicine. WetheP is medicine. We all have a medicine that we bring to the table. Every single one of us has a way of making our families whole, our communities whole, our organizations whole, our schools whole. And so what is it that we bring that's our unique contribution? That without us, it's missing. So I had to ask that, because nursing oftentimes is not very good. We do a little bit of everybody's work, so we end up being replaceable. People will say, well, it's not necessarily that you're there at the table, because the physicians have that covered, or the pharmacists have that covered, or the social workers can talk about the family. So what do? I had to really dig deep and unpack what is our unique contribution. And the unique contribution is nurses, for whatever reason, have a presence that is different. And when we're present with people, the stories come. And in the story is the healing. So without the patient or family or community's story at the table, healing doesn't occur. We might fix things temporarily, but we do not heal. Because the healing comes from the person or the family or the community, their story, and us all supporting them. And how we live that story forward.
Have to do with, I mean, we know if we take a certain drug that, you know, our heart will heal, or if we have a certain surgery and do our, maybe our PT, our knee will heal. And I'm setting you up for this. And what's the bubble over my head is my own experience, of course, with nursing, which I'm sure everyone has. So I had a child who was 3 months premature, very sick. And the doctors would come in and they were very systematic, which was very reassuring. They had a checklist. Did he do this? Did he do this? Did he do this? It was great, because you knew that they were covering the what was happening in his body. But they weren't doing much for me other than reassuring me that the nurses were the ones who, when I had to go home at night, had to get some sleep, they were there, and they were telling me in the morning the things that he did.
That's right.
When I was a little bit stressed and freaky, they would say a lot stressed and freaky, but we loved them. They were peeling me off the ceiling. So I think it has something to do with relationships.
Very, very much about relationships, but the type of relationship. So physicians have relationships. They want to get very quickly to the differential diagnosis. What is happening so that I can appropriately treat this situation? Fabulous. We need that. Absolutely, we need that. So your child who was 3 months old, 3 months premature, absolutely needed the most skilled diagnostician of how mature are their lungs. What's their current function? What do they need? What does this child need to survive? That's absolutely critical at the table of healing. But also critical at the table of healing is you, because without you, that's a piece of that child's success, that child's ability to thrive and survive. And so the nurse needs to be concerned about you, needs to be concerned about the temperature in the room. What's the environment like? What's going on with the environment? Is there too much noise? Is there too little stimulation? The fluids that have been ordered, are they being appropriately administered? I mean, it's this holistic container of holding this child and the parent and the grandparents and the fill in the blank as the healing occurs.
And so much of what the nurses do, in fact, I was in the hospital before he was born. We were trying to keep the inpatient child in, and he made it. He lived and is doing brilliantly, but he was impatient. But I remember in the middle of the night, when I was stressed and in pain and so forth, the nurses, I remember thinking, this isn't in their job description, because they would come in, and of course they were monitoring the baby, they were monitoring me, they were administering meds to us both, you know, steroids for the baby and agents to keep the baby in me, but they would take time out of their schedule. But that, I remember thinking, as a businesswoman at the time, I'm thinking, how do you measure that?
Well, that's the difficulty in nursing, and it's been the difficulty all along, is when you said it's not in their job description. It really is. It's not in the doctor's orders or the physician's orders, but that's only a fragment of what the nurse does. That's basically carrying out somebody else's medicine. It's carrying out somebody else's description of what needs to be done. But that's a fraction of what we do as nurses. The rest is this whole piece. And so if I ignored you, it would be similar to me ignoring administering a medication. It's no less important.
Wonderful. Okay, that explains it, because I thought, gosh, these are just wonderfully caring people. Most of them were women, although I had a couple of male nurses as well. But this is part of your job, so this is a critical part of your job.
It's and I want to stop us here because the job that people will right away go to is their checklist. Go in,
Right.
be nice,
Yeah,
serve
exactly.
water, etc. It's a part of our being.
Mm-hmm.
So I can go anywhere, and I don't tell people I'm a nurse. So we're
Right.
sitting next to each other on the airplane, and I may be opening a book and reading it. And before long, somebody says, you know, look at this. Is this normal? What do you think? Is this normal? Let me tell you about my son. My son is recently, and I'm called into being a nurse,
Into being.
even if I'm not at work.
So it's like a vocation in a
It's
sense.
very much,
And
very
but
much.
really
And
what you're getting at is a presence too.
it's presence, it's who we are, it's using our whole, everything we are for the service of people.